Can everybody hear me? Yes, great. Super. How many of you know how to do CPR? Apart from the legendary guys, Dr. Kenjom and Dr. Ravi, who are sitting here. So, how many of you think CPR is essential? Great. Yeah, so almost everyone. CPR is basically a life-saving skill, and everyone in this room, irrespective if you're working in sport or not working in sport, needs to know this. I would tell you why am I here apart from these MD guys is because I work with sports closely. I was working with English rugby and cricket and football as well. I assisted one successful revival of cardiac arrest and one independent revival of cardiac arrest. So let's go to how do we work in such a situation. Everyone must be aware of the difference between a cardiac arrest and a heart attack. That's where everyone gets confused. I've seen a couple of videos on internet when a person was sitting and the other person was standing and giving CPR pumps. That's all crap. Don't believe it. Don't believe it. I don't know what kind of videos are these, but yeah, don't believe it. So to understand CPR, you need to go back to your basics and your KG schools where you learned A, B and C. You just need to know that. And if you know that well, you can do a best CPR possible. A is for airway, B is for breathing and C is for circulation. By the time I just asked the pharma guys to help me set up the mannequins here and then I'll talk through. So airway is always, the upper respiratory tract where we look at. Airway should be clear all the times when you start with CPR. So there are few things which we need to look at, especially when working in sports environment. What are the things which you think can be obstructing the airways? Do you want to take it?
So guys, one more thing, what he has said correctly, don't believe everything you see on the internet, it's for everything, right? And learn from the basics, start with ABC and be very vigilant. And one ABC means always be careful while doing CPR. Though CPR is a life-saving procedure, you commit blunders and that can lead to fatal consequences. So try to give your best and try to learn here only and try to perfect your skills and try to do it as much as possible. The more you do, the better your hands will become. That is what is more important. We'll set up the mannequin here and we will teach you how to approach the patient first. The first thing comes from approach. And to further make it more precise, always expose the patients. That will come in more in the trauma part. Disability and exposure are the two more parts that have come up.
Right.
Okay, airway, breathing, circulation is must, but right now what they are doing a modification is that restore the circulation first. More towards CAB they are now going. So good effective chest compression. How to do it, what should be a good depth, and how we are able to judge that I am doing a good chest compression, that will be taught to you today. Okay, doing a good CPR is good for everyone, whether you are from medical background, non-medical background, you are a sweeper. If you know CPR, you can be a life rescuer every day.
And I would also request anyone who is working in high performance environment, wherever you work, irrespective of your association, I would recommend insisting them on having an AED in your facility. That's very essential. I'll show you an AED and the trainer in a meanwhile, and I would request Rishi and all of you that we will utilize the lunch break also to practice it. So, because I don't want to waste any time and I would want you guys to have more access to the mannequins and the technique. So, yeah, so we will talk about the approach and how to work on the airway, breathing and circulation, things like that. Yeah. So when we approach the patient, always make sure you are reaching towards the head side of the patient. So, yeah. So when you reach here, you are always towards the head side. Make sure you can stand and have a look. That would be better. Yeah. So, sorry. That's not. I think this is the best thing. So when you reach the head side, make sure the airway is open. How to make the airway open is, there are two things. First is always head tilt and chin lift. So you have to tilt the head and lift the chin up. So that's how you can have a look, and that also helps us to, remove the tongue pressure from the pharynx. So that's the first thing. And the second is, if this is not happening, if the jaw is still clinched, the second maneuver is called as jaw thrust, where you apply all your fingers under the jaw and apply an anterior and superior pressure. Yeah, sure. So can we on a table? Yeah, works. Yeah, works. Sure. I'll keep. Sure. So the second is jaw thrust, which we can have a look in detail. If the airway is obstructed, what can you do? Any clues? And what are the things which can obstruct the airways? Tongue, right? And if the tongue is there, what would you do? Sorry? Yeah, that would be great. Works. Yeah. No, this is enough. वो नीचे कर So you apply jaw thrust here under the jaw, and that helps us in opening up the jaw. As soon as the airway, as soon as the mouth opens up, you have to look inside the mouth if anything is obstructing. I have seen a lot of videos where people insert their fingers. Never do that. You're not going to do any benefit, but it will cause more harm. So there are things which we can use are called as Magill's forceps. If there's something which is solid inside the mouth, you can use it to remove that. And there's something called as handheld vacuum suction device, which you can use it for the liquid related things. Because in sports, a lot of people drink water, electrolytes and stuff like that. So you need that for the same.
Just one more thing, he is telling you the ABC. Even before starting the ABC, you should do two more things. First of all, stand near the patient, stand near the head and ask him, is he alright? If he doesn't answer, tap on the chest, tap on the sternum. If it doesn't respond to tap on the sternum, now check the carotid pulse. This is where CAB is now becoming more important. How much to check the carotid pulse? Maximum for 10 seconds. If there is no carotid pulse and there is no active bleed, you have to start CPR. That's why now instead of ABC, CAB is slowly taking place. So check the circulation first. Okay, and yes, before starting CPR, ensure scene safety, especially when you are on the roadside. Guys, don't start midway. First, you have to shift the patient also.
Right.
Now, why I'm telling you this is because on the field, there will be a lot of crowding. So first, you have to clear the scene. When the medical team is attention, the field should be made clear. That is what you need to ensure as a medical personnel. And yes, practicing CPR is equally important, but making a good rescue plan is definitely better. Okay.
Right, yeah. So on that part, in sports environment, we have something called as emergency action plan, which you need to have as a physios or medical professionals. You will need to have it prepared beforehand. Yeah, so let's get back to CPR, and airway we already discussed. In airway, we always do something called as look, feel, and so look is always looking inside, and if the person is breathing, that is, then we come to B. So breathe, you have to always feel and experience. So what you can do is reach near the ear, near the mouth, and keep your ear so you can hear if there is any air movement. If it is not, then you can think that, yeah, definitely the breathing is not happening. The second thing is feeling on your cheeks. So that is the other thing which you can do. And the third one which comes is,
the one more practical thing which we used to do when we were not expert in CPR, we used to keep a cotton whisk in front of the nose. If it used to move, we used to say that patient is definitely breathing. Another common method, not very commonly used, but it can work in some situations.
Right. But I would say in a sports scenario, when you are on the field, this would be more easy to do and convenient.
This method is very practical for everyone, and you can teach even to a layman, because it will be difficult to assess the breathing sound. He might be confused with other sounds, so much of noise on the field. So you can teach this cotton wisp method. very
Right.
practical for everyone.
Right. Then moving on to circulation, you have to feel the carotid pulse, which he already mentioned. If any of these is not present, you have to start CPR. And in CPR, there are two components. One is compression, and the second is rescue breath.
So guys, you have to compress the chest. Now what we are doing is that the heart is not pumping enough blood. So I'm giving an external stimulus to the heart via the chest wall that it starts pumping. And once the heart starts pumping, the first organ which we want to restore is the brain. That's why circulation is getting more importance now. Because they say if you do CPR early and you restore the blood flow first to the brain, the survival chances increase a lot. This is what the recent studies have shown. And guys, now the American Heart Association is saying you just don't have to do compressions, you have to do good compression. Now what does a good compression means? This means you are pressing the chest adequately also and allowing the time to recoil. Now what many a times in such an emergency situation people do is that they compress the chest very fast, but they don't allow the time to recoil. This is where half of the unsuccessful CPRs land up. The time to recoil is not good enough. Because when the heart contracts, it has to contract against the bony cage, the thoracic cavity. So if there is contraction of the heart but there is no relaxation, how there will be a refilling? So you need to give time both for the refilling and both for the ejection. But you have to do it fast and precise. Okay, so he will demonstrate with me.
Yeah. Also, one more thing is time is very crucial in this scenario. Loss of 1 minute of quality CPR is equal to loss of 10% of chances of survival. So you have to be very keen on identifying, you have to be very vigilant on identifying if it is a cardiac arrest and then start CPR immediately. So there's something called an ambu bag which you use. Since COVID, they've stopped doing mouth-to-mouth respiration, and instead of that, they introduced using the ambu bag. But what if you don't have an ambu bag? What will you do? You don't have to give the breaths. Instead, just maintain the airway and continue a good quality CPR. So that's the recommendation. In terms of CPR, what he mentioned is...
just one more thing I want to add. If you don't purchase an ambu bag, you can purchase this simple mask and keep it with you. And make a tight air seal with the use of a tissue paper and then give rescue breath. That is also good learning maneuver in the initial practice days. Okay, as this ambu bag can be a bit expensive for you, you can purchase the mask. This is also a very good alternate which you should have in your pocket.
And one more essential thing is, if you are in an environment where you are just alone with the person who has got this cardiac arrest, always ensure that you are getting some of the other help. Help is always essential in terms of, getting the ambulance and the medical guys, at your scene. That is very essential. And that will help you in, increasing the chances of survival. Yeah, so do you want to demonstrate the CPR and then go ahead? I mean, the compressions.
Okay. So I think compression, they should come here and
they,
because they will not be able to feel that what we are actually trying to do.
Because we are on the screen already. Show it here.
We can show here also.
Yeah. I'll hold the mic.
So while starting the compression, first of all, though we are standing here, ideally you should sit upon your knees. Okay, make a fist with both the hands. Okay, like this. And you have to apply the pressure passively from this hand, like this. And keep the shoulders extended and keep the elbows extended, and the force will be transmitted to the chest via your hands. Okay? But who will apply the force? The force will be applied from your hip, gluteal and back. So my question to all the physios, where is the strongest muscle of your body located? Glutes, yes. So who will generate the maximum power? Glutes will generate the maximum power. So during the CPR, when you will give compression, your back should move. Your glute should generate power, not your shoulder. Now, what half people do, the mistake is that they keep the shoulder crouched like this. So this crouching is not good. Okay? So you should sit first. Sit first upon your knee in the kneeling position. Keep the arms in this fixed and straight, and move your back and apply the pressure. This is very important and critical to generate a good compression and allow time for recoil. This is where half of the mistake is.